Now coming to the ART Act Level 1. This is the full form of that act. It was enacted on 18th December 2021 and it started, getting enforced from 25th January 2022. This regulates all ART clinics and banks. Here they have leveled, that is level 1, level 2, and surrogacy clinics are entirely different category. It is not categorized as level 3, but it's a different thing. So level 1, you can do only up to IUI. Level 2, IVF, ICSI, TISA, PISA, donor cycles, everything. But level 2 cannot do surrogacy unless and until you have applied separately for surrogacy in that form and you have been granted registration for doing surrogacy in your center. So what is the minimum staff requirement if you want to start your level 1 ART clinic? That is gynecologist and 1 counselor. What should be the qualification of gynecologist? Shall be a medical postgraduate. Counselor can be a graduate in psychology or clinical psychology or nursing or life sciences. These are the requirement of equipment and facilities. Remember, they do come for inspection. So these are the requirements. You should have centrifuge machine, ultrasound, laminar airflow, binocular microscope. This is according to the ART Act. From the Act, I have copied. Incubator, semen wash processing facility and a refrigerator. Now this is the counseling facilities which you all should have. That I am focusing on level 1 ART clinic. You should have a reception area, waiting room, consulting room, storage space, examination room with privacy, backup power supply and fire safety norms. Again, they have given norms for your consulting room, that it should have privacy when you are counseling your patients. If you are a male doctor, presence of a female attendant is must. Semen collection room, sir has already told you in great detail, but now it has been documented in black and white in ART Act that you should have a well-appointed room with privacy and an appropriate environment. It should be an in-house room and sample should be collected in a sterile container. This room should have a wash basin with availability of soap and clean towel, and this room must not be used for any other purpose. You should have a semen processing laboratory, that is a separate room with a laminar airflow for semen processing, preferably close to the semen collection room. You have to follow the good laboratory practice guidelines. You should have safe disposable of biological waste things in your place, and your all staff, including you, should be immunized against hepatitis B. You all should have a separate area or a separate room with an appropriate table for performing the IUI procedure. These are the general purpose clinical laboratory, that is for the endocrinological test or blood test. It is not must to have an in-house laboratory. You can have a referral facility as well. But you are supposed to have an autoclave room. Now how to apply? You all have to apply to your appropriate authority. There are designated forms. You have to fill that form. And for level 1, the fee is 50,000 rupees, which is valid for 5 years. Once you pay this fee, even if your registration is rejected, this fee is non-refundable. So once you apply, within 60 to 90 days, they will either give you registration, they will reject your registration. So if they reject your registration, you can appeal against that decision to the state appropriate authority. The state board will take a look on your appeal, and within 60 days of the receipt of your appeal, this is all ideal, the time limit is mentioned in the ART Act, they can either again accept that you are qualified for registration, or they can also reject your application. And the certificate of registration is non-transferable. That is, if you are changing ownership, you are giving it to somebody on rent, this certificate is not applicable to that another person whom you have rented your premises. the person has to apply again and has to take a certificate of registration from the date. So in the change of ownership or change of management of the ART clinic or the bank, the new owner or manager has to apply fresh and has to try for the registration. Now when it comes to renewal, now though we don't have reached that step, but yes, after 5 years, you have to apply for renewal of your registration as the validity is only 5 years. If you get certificate of registration, they will also upload on their platform, and you also have to display both copies of the certificate prominently in your reception area. If they suspend or cancel your registration, they do give you a show cause notice. They give you a reasonable opportunity of being heard, so you can put forth your case. This is how you can make appeal, and the state government where the appeal is against the order of the appropriate authority of the state, but you can even approach the central appropriate authority if you are not happy with the decision of the state appropriate authority. This is the manner of appeal. Again, there is a form which you have to fill. So it is in a prescribed thing you have to go and appeal. Every clinic or every ART bank has to maintain a grievance cell in respect of the matters relating to such clinics and banks, and the manner of making a complaint before such grievance cell can be specified. So even patient can complain against you. So you have to have a grievance cell. Now who can inspect your premises before granting you registration? It can be by the national board, the national registry, and the state board. These three agencies have the power to inspect any premises related to ART. They can call for any document or any material in exercise of their powers and discharge of their function, and you have to show them that document. It is binding on each and every clinic to follow the written informed consent, and that is very much available on the ART Act, and it is on the website. This is, I have taken the screenshot from that PDF format. This is the consent for IUI with husband, semen, sperm. This is in English, but in Hindi also it is there. And this is the consent for intrauterine insemination with donor semen. So you have to fill. Now all those ICMR forms are outdated. They have lost their validity. So don't stick to those forms. Download these forms, print these forms, and start filling these forms. Now these are the certain MCQs I have again downloaded from their website, because patients, they do come and ask you. So age limit, you should know, this applies to IUI also. The age limit is for women, it is 21 to 50 years, and for man 21 to 55 years. Beyond that, you cannot do even IUI on them. Unmarried woman is allowed? Yes. You should know that unmarried woman, you can do donor insemination according to the ART Act. This is for ART bank, so I will just omit. But as a gynecologist, you should know that according to this act, one sperm donor can donate only for one couple in his entire lifetime. Previously, semen banks, they used to have one donor and they used to make I don't know how many, 10, 20, 30, 40, 50. Now with the act, it is mandatory on their part also. So as a gynecologist, you should first ask for the certificate of that ART bank, which I have done. Don't go on their verbal thing ki madam, I have got the certificate of ART bank and mere se sample le lo. Don't do that, because you have to have that ART bank certificate in your file. So before start taking donor semen sample, do have the ART bank certificate, and do see to it that he does not give you the same sample for another couple. The same sample can be used for the second cycle in the same couple. The one man can give sample for 2 times, 3 times, but you have to use it for the same couple. You cannot use that man's sample for the second couple or the third couple. This is for your safety. Can a single woman who is unmarried undergo IVF or IUI? I again said yes. This is what the laws are saying. This is for the blood bank. These are all for IUI clinics, and this is for you all. Can a clinic mix semen sample of 2 or more individual? No, gone are those days. We still get request. Okay, madam, my friend is ready to give donate semen. My elder brother is ready to donate sample. We don't want anonymous sample. Please do it. Don't encourage. Don't do it. Don't fall in that trap. ART Act is very harsh, very rigid. It can be only from a certified ART bank. And the certified ART bank will be giving you only a cryopreserved semen sample. Don't take a fresh semen sample from this ART bank. So protect yourself when you do. Can a married woman undergo IUI without the consent of her husband? Answer is big no. That is why I said before you do IUI, you have to have the husband signature of both husband and wife. Don't do IUI first and then wait for the signature of the husband. For whatever reason she is saying, don't do IUI in that cycle. Patient counseling, yes, you have to do confidentiality, you have to maintain, and for donor insemination, you have to preserve the records for 18 years. Change of address, you have to register again. Staff requirement, I have told you for level 1 clinic, license fee for you it is 50,000 rupees. It is non-refundable, and once the certificates are issued, they will be uploaded by them also, and you will also be displaying in your reception area. I am doing level 2, so for me it is not mandatory to take a separate registration for level 1. Okay? But those who are doing only level 1, you have to have a level 1 registration before you start doing IUI lab. If you are not having level 1 permission, don't have the IUI set up in your facility, you are allowed to do counseling, you are allowed to do stimulation, you are allowed to do triggering, and you can have sample from outside. Okay? Because it is for the handling of gametes. So you are not handling the sperms. Or you take your patient to that facility where level 1 certificate is there or where level 2 certificate is there. Take your patient there and do your IUI. Who can inspect? Many authorities can inspect, and they can, practically speaking, they have the right to seek for any document. Previously, there were many non-bailable clauses in this, but now after so many representations from FOXI and ISAR, it has been toned down a little bit, and now these offences are cognizable and bailable.